Joining me now via Skype is the Director General, West African Organization, West African Health Organization, Professor Stanley Okoro. Professor Okoro, it's good to have you join me right now. First of all, let us talk about the issue of home care, as Kenya is putting it. Now, at a time, the Nigeria Center for Disease Control said that they were getting overwhelmed because some of the beds available at the isolation centers were getting filled up. Now, talk to us about how a home care would apply if that needs to be done. All right, Professor, we can't hear you, so I guess we'll have that rectified and then we come back to you. As we wait to have the professor back, let's move on with some other stories. And okay, I understand Professor Okoro is back.
Thank you very much.
Okay.
Thank you very much
for
the question. Yeah. As you well know, and your viewers can remember, the problem we have in Africa, West Africa, is the issue of infrastructure compared to developed countries. And therefore, we have to look for African solutions. And where the infrastructure is burgeoning, despite where the pressure on the infrastructure is burgeoning, despite the surge capacity that have been included, people can use home treatment and home isolation. There are, however, some criteria for that. There has to be an assessment by public health professionals of the home environment. There has to be some disinfectant of the home environment. You have to disinfect them first. And then you have to be sure that the person can be isolated and have almost separate living facilities within the same environment if they have other family members in the same home before you can then isolate them. Yes, home management is feasible and is being done, in fact, in some of our countries in West Africa. They're already doing that. You have a team that go in after a positive test to assess the home, to give advice, to disinfect, and then to ensure that other members of the home do not get infected or are not put in harm's way because somebody with coronavirus is being managed at home.
All right. Now, let's talk about the issue of easing lockdowns. Many countries are easing the lockdowns in their country. But we remember that the reason why there was a lockdown in the first place across the world was to contain or reduce the spread of transmission of the coronavirus from person to person. Here in Africa, in sub-Saharan African countries, the numbers are increasing, yet the countries are talking about easing lockdowns. Is there any health explanation to this for people to understand?
Okay, so the first thing to say is that it is not uniform, and we do encourage and charge, and in fact, the West African health ministers have already decided that at our meeting this week, that before you have decisions on easing of lockdown, it has to be driven. In other words, you have to look at the information regarding the evolution of the COVID-19 cases in your country. But remember, it is not uniform across countries. And so the smart thing to do is what some countries are doing, which is to determine areas where the infection rate is coming down, to determine areas where it is either stable or coming down, and it is possible to ease lockdown in those areas, then we ease lockdown. Whereas if you have hot points, we always insist and suggest that you should continue the containment within those hotspots. And of course, I'm sure you know that in our country, for example, there are areas where it is coming down, where it's going up. So that's number one. Number two is, let us understand that we are not going to have lockdowns forever. Now, one of the things we have to start sensitizing people is to the fact that coronavirus might be with us for a long time. We cannot therefore have total lockdowns of all our economies with the impact, economic, social, and health, of course, impact. And we must now start thinking of what we do. And that's why countries are looking at this. But the public health advice and what we have driven through in West Africa and has been agreed kindly enough by the Ministerial Coordinating Committee on Health of ECOWAS is that it must be data-driven. It has to be decisions made on the basis of science, on the basis of where the data shows that the infection rate has stabilized, we can then start easing those lockdowns. But of course, we also watch it and review it after 2 weeks with the understanding that lockdowns can be reapplied if there is a resurgence of cases.
All right. Now, WHO has resumed the trial of hydroxychloroquine as a trial drug for against COVID-19. And with that, after a back and forth, we also understand from the reports we're getting, people are also resuming self-medication, trying to take chloroquine to prevent themselves. How dangerous is this trend?
It is, first of all, let's say categorically that I am pleased that WHO has restarted or lifted the suspension of having chloroquine and hydroxychloroquine within the Solidarity trials. I mean, I remember that I was asked this question at my press conference 2 days ago, and I explained that there has been some criticism of the study in Lancet, but that WHO was right to have placed a temporary suspension, and I'm glad that those criticisms have now been looked at and they've lifted the suspension. I'm absolutely happy about that. It is extremely, extremely dangerous to self-medicate with chloroquine. Chloroquine has toxicity, and therefore we do warn people, please do not do that. Now, we have chloroquine, and chloroquine that we have offered to countries is to be used for treatment of severe COVID-19 pneumonia in hospitals where it is being done under clinical trials or what we call compassionate use. And therefore, you document who is given to, you give it with consent, you monitor them, and then you document the effects. Now, the reason why we should discourage people from self-medicating with chloroquine is because, frankly, we have all been saying we have the power to stop this COVID-19. From social distancing, washing your hands, making sure that we have all those respiratory hygiene and all the things of wearing masks that we have talked about. These are the critical ways for preventing yourself from having COVID-19, not a prophylactic medication, which we don't do.
All right. Thank you so much, Professor Stanley Okoro, for your time on the program, the Director General, West African Health Organization.